Everyone, I just wanted to say we'll start in a few minutes. Maybe we'll let the stragglers get in. It's hard to compete with plenary session on NIH dollars and the like. After this, there is a coffee break, so we have some extra time to run over. Don't be shy. You don't all have to sit in the back. We don't bite. Maybe I could do just a little poll of people who are here in the audience, and you could maybe just raise your hands. Who is a urologist in the audience? Okay, 2. How about GYN people? Another 2. How about neither nurse or allied professional kind of thing? Okay, good. All right, so we have the whole mix. Good. So since we are a small audience, we would like to make this as informal as possible. So please stop us or give if you have questions or something. This is not meant to run you over with too much information and stuff. So maybe we start? Yeah, we'll start. So let me introduce our faculty. Drew Peterson. I was going to joke, if you Google Andrew Peterson or Drew Peterson, Andrew Peterson is a Christian musician. He has a Wikipedia page. Dr. Drew Peterson from Duke does not have a Wikipedia page. Even the murderer, Drew Peterson, has a Wikipedia page. But Dr. Peterson is an esteemed professor, full professor. He is residency director. He really is kind of the father of urologic cancer survivorship. He has established a program, and you'll hear about his program at Duke. He had a residence fellowship, in cancer survivorship. And he'll maybe address a little bit about that as well. I've tried to follow in his footsteps and do some cancer survivorship, but he has very big shoes, so it's hard to follow in his footsteps. But as you know, when we talk about cancer survivorship, we're talking more about quality of life measures after your NED from your malignancy, which is commonly ignored. So all of us are surgeons, urologic surgeons, who deal with the complications of cancer therapy once people are NED. Dr. Ruttman on the other side is associate professor at Columbia University. He's the director of avoiding dysfunction in female urology at Columbia. And he'll be talking about his experience about cancer survivorship and urinary incontinence. Myself, I'm going to talk about, I'm also at Columbia University in New York, and I'll be talking about urinary fistulae, mostly recto-urinary fistulae. It may be a little too surgical, so I'll modify my talk based on your interest in the audience. And Dr. Sukumar is our fellow in reconstructive urology at Columbia University, and he'll be talking about the devastated outlet. Essentially what that means is severe bladder neck contracture, outlet stricture of primarily the male urethra. And then what do you do if a patient's been radiated or had some iatrogenic or post-cancer therapy stenosis? How do you manage that? So our first speaker will be Dr. Peterson, and he'll be talking on his experience with the fellowship and developing this program, and about the buy-in that you have to have from your hospital, from your cancer center, and from the administration of the hospital. That's been my difficulty. I moved from St. Louis to New York a couple of years ago, and you really have to have buy-in from the powers that be, that they have an interest in it, because the conception of survivorship is very odd. You know, they look at it as, oh, NED, that's great. That's all we care about. But we want to follow up with the malignant. So Drew will tell us about how to set it up and his trials and tribulations and successes. All right, thank you, Drew.